Hi, uh, hearty welcome to all great lovers of homeopathy to this Zoom session. It is a universally acknowledged fact that medicine has made great advances, tremendous advances in the modern times. Scientists have succeeded in probing deeper and deeper into cells and understanding the working chemistry of cells and pathological processes. A very funny thing which happened recently is we have even discovered a new organ, a new human organ, a few cells which were quietly surrounding our viscera in the abdominal cavity. It was peritoneum that was recently elevated as a new human organ. And we have a lot of information. We have accumulated a plethora of information about bacteria, about viruses, about pathological processes, etc. But despite of the great knowledge we have accumulated about bacteria and viruses, these minute organisms have devised very ingenious methods to overcome and circumvent all the steps and measures we are taking to prevent infection from this infinitesimal living beings. So in spite of the great advances we have made in medicine, a lot many bacterial and viral infections, and just right now in the whole world we are being plagued by COVID-19 viruses, which is completely baffling the medical community of the whole world. And so in spite of all this information which you have accumulated, that is where the relevance of homeopathic medicine comes in. Because despite of all the information we have accumulated about viruses and bacteria, one thing which modern medicine has failed to understand is that human body is not merely an aggregate of a few million cells, but it is a unique living entity, different from person to person. And unless we understand that, we will not be able to understand and cure some of the great pathological problems which are baffling the medical community at present. And dear friends, I am presenting before you two cases before you where these individuals suffered great suffering. They had prolonged agony from their diseases for several years. They had been to the best hospitals, best corporate hospitals in Kerala and outside Kerala, in India, and even many parts of the world. But nobody could do anything to alleviate the suffering these people had for years and years. And then these people came and saw me. And all what I did was I took a proper case in the homeopathic format as prescribed by Samuel Hahnemann. I tried to understand what is the problem affecting these persons above and beyond what was happening in their cells, what was happening in their body chemistry or in their body fluids, etc. I tried to understand what was happening to these persons. And then I gave homeopathic prescriptions, which went a long way in shoring up their immune system. And they were able to ward off their pathology and the invading organisms which had made them suffer agony for years and years and years. Hahnemann says in aphorism number 3 of Organon, which is the main treatise of homeopathy. In aphorism number 3, Hahnemann talks about the knowledge a physician should possess if he wants to cure, if he wants to treat uh, 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 human maladies successfully and judiciously. Hahnemann says in aphorism number 3, in the beginning of aphorism number 3, Hahnemann says, if the physician clearly perceives what is to be cured in disease, if the physician clearly perceives what is to be cured in disease, my dear friends, my dear people who are listening to my talk, let me tell you that just small word in, that is the key to understanding homeopathy. Hahnemann never told us if a physician should clearly understand what is typhoid, what is pneumonia, what is cholera, or what is COVID. There was, of course, no COVID in his time, but there were some viral diseases which even he may not have known and which suffered innumerable agony to the mankind in those days also. Hahnemann never said, if you knew about typhoid or pneumonia or tuberculosis or any such infection, but Hahnemann said, you should know what is curable in disease. That is what Hahnemann said in aphorism number 3. If the physician clearly perceives what is curative in diseases, what is curative in diseases, that is the derangement of the vital force, isn't it? As we homeopaths understand, what is curative in homeopathy is the derangement of the vital force. Derangement of the vital force is the all-pervading regulatory mechanism which coordinates all the functions of the human body. And as Hahnemann says in aphorism number 9, in the healthy condition of man, the spiritual vital force, the vital force, the dynamics that animates the material organism, rules with unbounded sway and retains all the parts of the organism in admirable harmonious operation, so that the reason gifted indwelling spirit can freely employ this living healthy instrument for the higher purpose of revision. So, my dear friends, it is a healthy vital force which is the sole and arbitrary key to health in a human being. And it is this derangement of the vital force which we have to correct. If there is a derangement of the vital force, that is what a physician has got to correct in the first place. Because when there is a derangement of the vital force, the overall supervisory mechanism of the body suffers. And therein, through that lacunae, therein, through that opening, any pathological process and creep in and affect that person. The great homeopath, Dr. Rajan Shankaran, described this derangement of the vital force akin to a pole which is planted somewhere. A pole, a long pole which is planted somewhere. You see, if you plant a pole on earth somewhere, what happens is sooner or later, some creeping plant will entwine itself around this pole and climb on top of that pole. You see, the central pole can be described as the derangement of the vital force. When the derangement of the vital force which occurs, the creeping plants or creeping pathology will entwine itself around this pole and climb and completely overcome this the person affected by it. So what happens? So when we are treating with modern medicine, what many modern medicine doctors do is they try to cut off this creeping plant. So what happens if you cut off the tendrils or the stalk of this creeping plants, the root is remaining there and it will again sprout and climb up again along the central pole. And even if you remove the whole plant itself, even if you remove its roots also, as long as that pole is remaining there, some other creeping plant will come there and entwine around the pole and climb on that pole. That is what is called disease, my dear friends. When there is a derangement of the vital force, which is a regulatory mechanism of your whole supervisory mechanism, the whole body has suffered, some pathological process or other will definitely come and entwine and enter through the weakness which has been caused in the immune system of that particular person. So what we should try to do is remove that central pole or the derange or correct that derangement of the vital force, which is allowing disease in the first place. And the derangement of the vital force, my dear friends, it is not something which can be seen just through blood analysis or study of some body fluids or through some scan or any other mechanical processes like that, because the derangement of the vital force is a process which is manifested, which is manifestly seen both in the pathological process and also even inside the mental makeup that particular person, even in the mind, that derangement of the vital force which we are running. And what a homeopath does is, and what a homeopath should do is, the derangement of the vital force as can be seen through the physical and mental symptoms, and then prescribe for that derangement of the vital force. And if you are able to prescribe a medicine which will correct, which will compensate that derangement of the vital force, my dear homeopaths, that is practicing good homeopathy. Don't just merely think in terms of pathology, rise in few blood cells, or some abnormality in a body fluid, or some hypertrophy in the part in the body or anything like that, but think in terms of the whole person, and think in terms of the derangement of the vital force, which is the main encompassing force which is allowing diseases process to come inside the human body. So, my dear friends, I am presenting before you two cases where people suffered from their agonizing disease for several years and years, and they had went and consulted specialists, very well-known, illustrious specialists in Kerala, outside Kerala, and even outside the world. But none of their examinations of the blood or scan or any of these things was able to unravel the real mystery of the cause which was causing their diseases. And I shall tell you about those cases. The first case was that of a woman who was a health worker, who was a nurse in the government health sector of Kerala state. This woman was working about 40-50 kilometers away from my place in a fairly big town, and she was working in a fairly big government allopathy hospital. And this person developed a fever. By the way, let me tell you, this person came and consulted me for such a very simple thing like a fever. That is all. My dear friends, she had not seen me for cancer, or she had not seen me for a heart problem or any other neurological problem. She came and consulted me for a very trivial thing, as trivial as just an ordinary fever. But the funny thing about this fever was that this fever had started 19 years back. 19 years back. Do you understand? This woman, when she was working in a government hospital, big government hospital, about 19 years back, one day she developed a bout of fever, hypyrexia. So because she was working in the hospital, there were many specialists in that hospital, and she went then told this to a medicine specialist in that hospital. Oh, she said, that's a minor infection. Don't worry about it all. Just take this tablet. He gave her some paracetamol or some anti-febrile medication, and then some other pain reliever or something like that. But after 3 days, this woman's fever had not subsided even a wee bit. So she again went and uh, complained to this physician. This physician, oh, your complaint has not been relieved yet. Oh, I see. Don't worry. I'll give you a shot of an antibiotic. So he gave her a shot of an antibiotic. And that antibiotic she had to take for 3 or 4 days or 5 days or something like that. But after 5 days of this antibiotic, this pyrexia did not budge even a little bit. And she again went and told this physician, sir, my fever has not abated. I'm still having high fever. The physician himself was greatly surprised. The physician said, oh, how come? After this antibiotic, this fever has not subsided. But don't worry, I have a few more shots up my sleeve. And he gave her an even more powerful antibiotic. One of the most powerful antibiotics available at that time, about 19, 20 years back. And she took that antibiotic for another 5 days or 1 day. But even after another high-tech antibiotic, the fever did not subside at all. So the woman became alarmed, and she went and consulted a private hospital with all kinds of departments, medicine, cardiac, neuro, and all departments. There are multidisciplinary hospitals. And she went and consulted the physician of that hospital, who admitted her in that hospital. And she was admitted in that hospital for about 1 week. And they did all the tests for a case of pyrexia. Whether it was typhoid, whether it was pneumonia, she had respiratory complaints also. And they did all the investigation, other investigations, routine investigations, like X-ray, this thing, that thing, all the blood investigations. And nothing, no investigation revealed anything very specific. She had merely a little bit of raised erythrocyte sedimentation rate, and white blood cells were a bit high and things like that. That is all. Nothing more specific could be found. So after about 1 week, because this fever did not subside, this woman became greatly upset and panicky, and she went and consulted one of the most famous physicians in Kerala, in one of the biggest private hospitals in Kerala, in the capital city. A very huge private hospital in Kerala capital, Trivandrum. And there she was admitted for 21 days. 21 days for a fever episode. And they did every imaginable investigations which could be done on a human being. All the blood tests, scans, various kinds of scans, and all investigations of body fluids. They did an LP, lumbar puncture, and even investigated whether there was anything wrong with the cerebrospinal fluid. But you see, nothing specific could be found what exactly was causing this mysterious fever. No culture revealed, no kind of organisms. All what the physician, the very famous physician in that high-tech corporate hospital of Kerala could say was, it was a fever of unknown origin, pyrexia of unknown origin, PUO, pyrexia of unknown origin. Maybe the COVID virus was not discovered 20 years back. It could have been a cousin of COVID or something. Maybe. So after about 30, 40 days, after intense treatment in lot of allopathy hospital, this poor woman was not having any abatement of the severe fever which she was, which was possessing her body. And then she thought, after all, I am a government health worker. Why shouldn't I go to the Trivandrum Medical College? Because the biggest hospital in Kerala, and it is a teaching hospital. People study there for DM. After MD, they study there for DM. There are numerous professors who are well experienced, who have treated hundreds of thousands of people of all kinds of imaginable diseases. So she went from the high-tech hospital to the government medical college at Trivandrum. And because she brought in all kinds of reports and investigation reports, the director of the medicine department himself attended the case. He racked his brain to find out what exactly was causing this problem. Even he could not identify what was exactly wrong with this person. He also could merely support the diagnosis made by all other physicians that it was a case of pyrexia of unknown origin. And there she lay in that hospital for about 1 or 2 weeks. After about 2 weeks, what happened? A funny thing which happened was a house surgeon who had just finished his MBBS, basic medical degree. He went and saw this poor woman and gave this woman some trivial medicine over. And then the fever went down. Her fever was reduced. And so she heaved a sigh of relief. Oh my God, whatever happened, although nobody knows what was exactly wrong with me, anyway, I am free of the dreadful disease. I am free of the fever. Thank God I am saved. Okay, whatever happened, I am free now. I'll be thankful to God. And she went back to her native place, thinking that her problem had been completely erased. But my dear friends, what happened was this fever again reappeared after 2 weeks. Again, another episode like that. So, my dear friends, what has been happening for the past 19 years was this woman has been having episodes of unspecified fever, pyrexia of unknown origin, for the past 19 years. She came and saw me 2 years back, so about 21 years back. And this fever will come suddenly without any notice, without any precipitating factor, without any provoking reason at all. She will get a sudden onset of the fever and she will be laid down with great suffering, with great pyrexia and great myalgia, with etc. and all these things. And she will be like that for a period of time which nobody can predict. That fever episode may last from 4 or 5 days to 1 or 2 weeks or even more. And no amount of antibiotics, no amount of allopathic medicines of any kind could give her any kind of relief at all. After that, she went, she wandered throughout Kerala, visiting all the major hospitals of Kerala and seeing all big names of Kerala in the medicine department. And none of these people were able to tell her what exactly was the provoking, precipitating factor which was causing the fever. And then after 19 years, somebody suggested, oh, there's a homeopathic doctor in Anchal Town, Kollam district. As a last resort, you can come and you can go and see that person also. So this person came and saw me about 2 years back. And you see, what I did was I just took a case as Hanuman said in portion number 8. The patient details his history of his suffering. Those about him say what they have heard him suffer of, what he has complained, etc. The physician writes down accurately all what the patient and his friends have told him in the very expression used by the patient. The physician sees, hears, and remarks by his other senses what there is of an altered or unusual character. This was exactly what I did when this woman came and saw me. And I wrote on whatever she was telling. This woman has having sudden onset of fever without any precipitating cause at all. Severe pyrexia with respiratory symptoms, and then there will be great prostration when she has developed this pyrexia. She gets chills. She gets chills during the fever. She has very poor thirst. When all physical exertion produces great debility. In fact, debility is a very strong factor with her. Whenever she develops this disease, she will be highly prostrated. She will be highly debilitated. She won't be able to lift even a single finger. She'll be so weak. She has arthritic pains of her joints. Initially, it was on her hands, and then now it has climbed up to shoulders, and it has also affected her elbows. And these complaints are worse during sleep, but when she gets up in the morning, these complaints are better. Now, she has pains of elbows. Complaints are worse in cold climate. Uh, uh, Little tensions affect her. That is what she told about me. Tensions means little things which upset her have great effect on her body. And when I probed the family history, her paternal auntie and paternal uncles died of cancer. Patient has a great aversion to milk. She desires chicken, and she desires meat also. She's made easily sad. She has got very poor memory. And she told me when I probed her early years, when the childhood years and her adolescent years, what she told me was when she was studying in the school and college, she was an extraordinarily bright student. She was very bright, but she feels she has not come up to the level uh, which she should rightly have arrived at. She feels she has not risen to the level of eminence which she rightly should have reached. She feels uh, uh, she has not achieved her promise, early promise. She has not come up in life as much as rightly she should have risen. She says, there have always been hindrances in my life. Whatever I desire to, some hindrance or some other will come and block my way. She, and then where she is working, in the hospital where she's working, she believes all her colleagues are up against her. She believes her colleagues are trying to harass her and put her into all kinds of difficulties. She believes her colleagues are conspirators. She believes her colleagues are trying to conspire against her. Uh, and then about her family life. She is living with a husband in a house of their own, but her parents' house is adjacent to their house. Only one or two houses removed from the house where she is staying. Actually, if she stands on the balcony of her house, she can see the house of her parents. But the sad thing about her is that although her parents' house, her pop and mom are living so close by, she cannot go and visit her parents because her husband has got a very bad relation with her parents. So because of the estranged relation which her husband has got with her parents, she is not allowed to go and visit her parents. And those of uh, uh, lovers of homeopathy who may be listening from Europe or some other state, this is a funny state of India. When a woman is married, but perhaps as not as in West, the women in India may not have that much independent stand as far as India is concerned. So she's very much subject to the whims and fancies of her husband, and she will have to capitulate to the wishes of her husband on several counts. She cannot take a very independent stand as people can do in Europe or the States or some other place. And because her husband was estranged with her parents, although their house was so close by, she could not go and visit them. What she said was, Doctor, also there is a great, the China's wall between my house and my parents' house. Or even a mountain. It's almost like a mountain is separating my parents' house from my house. I cannot climb over this mountain and go and see my parents. That is a situation she finds herself in. And then about her working schedule. She works in a hospital as a nurse. And when she comes home, her favorite occupation is she just sits in the front sit out of her house on a chair. She just sits there and does nothing and will go on sitting there for 1 or 2 hours even. And even if her children come and say, Mom, come and give us something, or get us this thing, or do something else for us, she wouldn't turn even a little finger. She would just sit there. And even when her husband comes and says something to her, she just sits on that chair and goes on thinking and thinking. And she goes on daydreaming. She goes on daydreaming what she will do in her life. All kinds of impossible things she will plan sitting on that chair. And her husband says she has developed roots on that chair from the posterior part of her body. It is as though she has developed roots to that chair, and she cannot get up from that chair. And when she gets up from that chair, she finds it very pleasurable to harass her husband, saying something or other. Harassing her husband is one of her favorite pastimes. And she has very little interest in household matters. The household matters should be managed by the poor husband, which is a very funny thing as far as the Indian situation is concerned. But she wouldn't do a little anything. She wouldn't move even a little finger to do anything at her home. Okay. So we will we can have 5 minutes of interaction. The audience, if any of you want to say any comment, please don't suggest any remedy. But if you want to suggest if you want to have any comment, we can have comment interaction. Comment. You can tell me your comments for the next 5 minutes. Okay. Audience, anybody wish to have some comment on the situation of this woman's suffering and also about herself?
Dr. Badran sir, please comment.
Thank you, Doctor, for your concern.
Okay, sure, Badran.
Speak a few words.
I can.
Dr. Prasad Oommen is very close friend of mine. I know that he will practice. He's practicing as per Dr. Hahnemann's principle in the most theoretical and comprehensive way. And I am not going to comment which medicine is going to prescribe. I know that it will be a classical medicine. I know him well, and we are here. We are expecting what you speak in this question. Thank you.
Thank you, Badran. One or two more persons, please.
Yeah, I also wish to make a comment here. I wish to note the conflict that lead to problem. The conflict in the mind that lead to the problem.
Oh, sure.
Very interesting point to note here.
Please don't suggest a remedy. Please don't suggest a remedy.
Okay. No remedy. I just want to for the audience to note that point. That's all.
Thank you. Very good.
Yeah.
It's a good insight. Okay.
Yeah. Next is Dr. Hubert. Dr. Hubert.
Can you hear me, sir?
Yes. Sure.
Some other things should be known. What is her beliefs and whether she is wearing some religious material?
No, I didn't see her. No, I didn't see her wearing any special religious ornament or any religious marks.
Basically,
she's a chilly person. She's very sensitive to the cold. Chilly person.
How much is her mental state? How much it is affected?
Mental state, she's highly anxious because this thing has been going on for 19 years. See, doctor, a person has been having a stupid fever. See, where people are treating cancer and people are treating all kinds of pathology in the world. But a fever episode which has been running for the past 19 years and umpteen physicians in the whole Kerala have not been able to find out what exactly is causing this problem. And you can understand her mental state. She is highly anxious and she is highly troubled about this stupid thing which is agonizing her. Greatly harassed, she is greatly tortured.
Yeah, I think that it is originated from her mental conditions.
Yeah, definitely, sir. Definitely, I agree with you.
Thank you, sir.
Okay. If there is one more person, we can.
Yeah, there are two more persons. There are four persons raised their hands, and I am meeting Dr. Mr. Parit Bavakan. Next is Mr. Parit Bavakan.
Okay, Dr. Parit.
Dr. Prasad Oommen, good evening. I am not a homeopath.
Okay.
I'm a homeologer. You have made an analytical and anecdotal presentation, very interesting presentation. We are all waiting to see the next part of the story.
Okay, sure.
Actually, very interesting. Anyhow, very good presentation.
Okay, thank you.
Thank you. Waiting for your next part of the story.
Okay. Thank you, Dr. Ms. Parit.
Dr. Danesh.
Oh, Danesh Pai from Muhammad. Welcome.
Good evening.
Good evening.
Good evening, sir.
Please don't suggest any. Danesh, please don't suggest a remedy. But fast comment.
Yes, sir. It's very nice to see you here after a long time, and I couldn't attend your last seminar. And I have heard some of your classes for students last time. but I couldn't hear fully.
Oh, I see.
Anyway, your case presentation was excellent during the time also. And this time you are doing a different case, and I couldn't hear the first part of the case.
Danesh, a woman has been having fever for 19 years. Fever, yes, just fever. Episodes of fever of the past 19 years. She has consulted all the physicians of Kerala, and nobody has been able to find out what exactly is precipitating this fever.
Yes, as a homeopath, we need to find out the cause. The fever is the effect of some other cause. So if we are able to find out the cause, because I think that she's showing the signs of superiority complex, and she wants everything to be done. She considers her husband as something inferior, and she's just like a boss and doing work for the family. So that may be there may be some reason in the childhood also for that, or sometimes it may be after the marriage because of some troublesome incident.
Yes, there has been there's a troubled situation in the family front, because her husband is estranged with her family, and her husband does not allow this woman to go and see her parents at their house, although their parents are staying very close by, just one or two houses away. And what this woman says is, it is as though a mountain is separating from me and my parents. Mount Everest is placed between me and my parents, and I cannot climb over this Mount Everest, and I am not able to climb over this Mount Everest and go and visit my parents. That is what she says. Yes.
That frustration is the reason for this.
Okay, frustration. Yes. But her house, Dr. Danesh, her house is only 2 houses away. But she is not able to go and see her because her husband does not allow her. Okay. And she sees that situation as a mountain is separating her away from her parents. That is what she feels.
Yes,
what do you think? What do you think about that mountain?
Yes, she cannot break the mountain. That's the reason why she's chained. I must say that she is chained.
Okay.
Chained everywhere, so she cannot move away.
Yes. Okay. Dinesh. Okay. Right.
Dr. Anil Kumar TP. Dr. Anil Kumar TP.
Anil Kumar. Yes. Good evening, sir. Good evening, sir. Your presentation is very nice.
Okay.
And that mountain, that is.
Sorry, please unmute from your side once again.
Yeah. Good evening, sir. That separation conflict, that is the reason.
Okay.
That is the key of the case.
All right. But why is she not able to go and visit her parents?
She can't break her the chain, the relationship between her husband and her. That's the reason.
Okay.
So he's under the control of husband. That's the reason.
Okay.
Also, mental that conflict is the reason.
Okay. I would like to ask you one just. Okay. Right. Okay.
Thank you.
So,
there are 2 more hands raised. Dr. Binduraj, please make short.
Binduraj, my friend from Punalur. Okay. Dr. Binduraj.
Doctor, good evening.
Good evening.
Doctor, I think she is feeling that some conspiracies is building around her. You told that
she's
fearing she's suspecting some conspiracies.
Okay.
Maybe it is a key thing to that medicine. And along with that, some complexes, some superiority, some hierarchical thing with her.
Okay.
That I perceive, I think.
All right. Thank you. Okay. Thank you, Binduraj. Okay. Thank you, Binduraj.
Yeah, Sridhara Kurup, sir.
Kurup,
please unmute from your side, sir.
My close friend from Kotte.
Please unmute from your side, sir. Kurupu sir, you can unmute from your side. While waiting for Dr. Sridhara Kurup to unmute, I wish to say one more point here. It is time for medical researchers to incorporate the involvement of mental emotional state of a patient into consideration in the development of diseases, especially chronic diseases.
Yes. Who said that? Who said that? May I know what's your name?
Dr. Shaji Kudiyat.
Oh, Dr. Shaji. Okay. Well said, Dr. Shaji.
But I am.
Okay, since Dr. Kurupu doctor is not coming in,
Sir is not coming, so you can
okay.
doctor, you can
Let me continue.
I think that we have to know the parents and the relationship. What is the reason why she could not make a good relation with her parents, or otherwise there is any hindrance from his
okay, doctor, she is having very good relation with her parents, but the problem is her husband is not on good terms with her parents, and he is not allowing his wife to go and see their parents. And this woman that sees that particular situation in a particular way, she feels as though a great wall, just like the Great Wall of China, it is as though a great wall is separating her from her own house and her parents' house. And in another imagery she paints about her relation is, it is as though a mountain, not merely a wall, there's a mountain between her house and between her parents' house. And like the Mount Everest is there, and she is not able to climb over the Mount Everest. So that is a situation, that is the way she views her problem. So, my dear doctors, let us come back to the point, because the time may be limited. So let us come back to the point. So, so what I did was, and as Dr. Shaji Kudiyat said, the mental state is most important, because in Hanuman says in Aphorism number 211, it holds to such an extent, the state of the disposition chiefly determines the selection of the homeopathic remedy, as being decidedly characteristic symptom, which can noises are coming in.
Danesh.
Okay. It holds to such an extent, the state of the disposition chiefly determines the selection of the homeopathic remedy, as being decidedly characteristic symptom, which can least of all remain concealed to the accurately observing physician. This is what Hahnemann said. The state of the disposition is the most characteristic symptom on which you can prescribe a remedy. That is what Hahnemann said in Aphorism number 211, as enforcing once more agreeing with the idea Dr. Shaji Kudiyat said. Okay, so let us evaluate her situation. This is a woman who has been getting fever episodes for the past 19 years, off and on. She will get it maybe for 2 weeks, then for 1 month or 2 months, she may be free from those episodes, and again she will develop. So she has been getting this episodes off and on, unknown cause. She's a very chilly person. And describe, let us see how, and when she gets this fever episode, she is attacked with great debility. She cannot lift even her little finger. She is a highly chilly patient. And then, of course, you must understand when she, we have to understand, when she talks about her mental state, she says she was a very bright student in her school and adolescent days. But she has become a nurse in the government sector, but that is not the level to which she should have risen. Considering her ability and considering her intelligence, she should have risen to even a much higher level in her life. She has not achieved her promise. That is what she told me. She has not achieved her promise. You see, So, and what you said, that there has always been hindrances. Whenever I try to do something, something or other came on my way and blocked my path, and I could not proceed further. There have been hindrances throughout my life. That is what she said. And she has not been able to achieve her life's promise. She believes she's unfortunate, doesn't she? She believes she's unfortunate. And then in her work front, she's having problems with all her colleagues. She feels all her colleagues are trying to conspire against her. So delusion, conspiracy, delusion, other people are conspiring against her. And delusion, other people are harassing her. Delusion, other people are tormenting her. That is the way she views her work front. Okay. And she is not able to do anything. And then when she comes home, what does she do? She sits in front of her sit out. She sits on a chair and sits there for hours and hours and hours together without doing anything. Just see that there is a rubric in repertory: sit to desire to, sit to desire to. But of course, we must understand everybody sits and stands and walks and all. But the rubric sits cannot be used if a person just sits. If I am also sitting here, you cannot use the rubric sit to desire to. But if there is something abnormal about the way a person is sitting, if a person is sitting rooted in a place for hours and hours together, that is something which can take as a rubric: sit to desire to. And this remedy, which is necessary for this woman, will be found even in that rubric: sit desire to. Okay. And her husband himself says this woman has developed roots from the posterior part of her anatomy, and she is rooted to the chair where he is sitting. And what does she do sitting on the chair? She is building, daydreaming. She was building castles in there. So this is a woman who is a person who is building castles in there. Check for the rubric: building castles in the air. Okay, building castles in the air. She may see plans and plans and plans, all kinds of impossible dreams. She's weaving, she's possessing. She's not able to do anything. She is merely daydreaming. A person who is a daydreamer, a person who is a person who sits rooted to some place without doing anything. She has got aversion to household jobs. Check for the rubric: aversion household jobs. She doesn't do anything at home because all the cooking and all the other thing manipulations inside the kitchen is done by her poor husband. So how can he become not estranged to her and her family people? The poor guy is toiling hard in the kitchen. And then she has got aversion to household jobs. Okay. And then about her, the way she views her situation. She believes there's a wall, a China wall, great wall of China between her and her house. How do we view it from the homeopathic point of view? Delusion, you are obstructed. You are hindered. You are hindered. Whatever you want to do, you are hindered. She said from her adolescent age also, because she is so intelligent, she very bright. But some hindrance or other came whenever she wanted to do something creative or something positive. And even in her personal life, she feels there is a hindrance because her husband is objecting her. But suppose she had been very nice to her husband, suppose she had talked to him in such a nice way as women are able to do with their husband, suppose she had talked in a very endearing way to her husband, maybe he may have relented and allowed her to go to her parents' house. But when he just objected, he feels it as an insurmountable problem, insurmountable, because a problem over which you cannot climb at all. It is a Mount Everest. It is a Mount Everest. It's a problem as big as Mount Everest. how can you climb over the Mount Everest? Nobody can climb over unless you are a mountaineer like Tenzing and Edmund Hillary. How can an ordinary person climb over the Mount Everest? So the problem is as big as the Mount Everest. So this is the situation. She's delusion, she is hindered. Delusion, there is an obstacle. Delusion, blocked. Whatever she wants to do, she is blocked. And she's a chilly person. And she has been getting intermittent fever. So I have given you the remedy in your hands. I have given you the remedy in your hands. Please, audience, please tell me what is the remedy. Because anybody, any homeopath can now tell me what is the remedy. A person who feels hindered, a person who feels unfortunate, a person who is blocked in whatever he wants to do, a person wants to harass other people, a person who thinks that all other people are conspiring against her, and a person who believes everything she does is being blocked by something or other. Okay. And she a person who just sits rooted and building daydreams and castles in the air. Okay, come on, audience and my dear friends, please tell me, what is the remedy? Please tell me, what is the remedy? Somebody can tell me what is the remedy? Please tell me what is the remedy.
If anybody wish to comment, please raise your hands.
Anil Kumar, TP Anil Kumar. Nobody is volunteering. You feel there's a big mountain Everest between you and me. Delusion, there is a big wall between the audience and poor Prasad Oommen. Nobody is able to climb over this.
Dr. Binduraj.
Dr. Binduraj is a great adventurer with a great spirit of adventure. He climbed over any mountain.
I am so much afraid to say the medicine because nobody is saying, and I am just trying it.
Okay.
So kindly excuse if it's wrong, and I think it is Plumbermet.
Plumbermet. Okay. Has got Plumbermet is a paralytic person. No paralytic person can climb over the Mount Everest. But this person is healthy in other way. Only thing is having intermittent episodes of fever. Does Plumbermet has any intermittent episodes? And does Plumbermet has any delusion like this? Delusion you are hindered, delusion you are blocked, delusion you are unfortunate. Has Plumbermet got any delusion like that?
Delusion of a conspiracy.
Conspiracy may be a little bit there. Maybe a little bit there. But is he blocked? Is she hindered? Is she unfortunate? Dear Binduraj, I don't think Plumbermet has got any such unfortunate feeling. But I thank you really very much for your volunteering. Thank you. You are making a good attempt. We are making a good attempt. Okay. Somebody else? Dr. Badran, from you would like to come from Nayatinkara to Anchal, but you believe exactly at the Keshwasupuram, there's a huge mountain. You cannot climb over the huge mountain at Keshwasupuram. Okay. If nobody else is volunteering, because everybody is blocked here, and I shall tell you the remedy. I shall tell you the remedy. Okay. The remedy is the remedy, the first remedy which Hahnemann proved for intermittent fever. What is the remedy?
China.
China. It is a remedy for intermittent fever. Is this woman having fever for whole 119 years continuously? No, she has been getting intermittent fever. So fever once in 1 month, and then trouble-free episode for 1 month, and then again after 1 month she again will get it. But after maybe 1 week or 2, the fever will go away, but it will reappear. So this is a case of intermittent fever. China is a chilly remedy, isn't it? And if you read the China Materia Medica, you will understand that China has great unfortunate feeling. China feels it's a great unfortunate person. I am a great unfortunate person, greatly unfortunate person. I've got a lot of ability, but some force or other thing is hindering my progress in my career. So I am being hindered and blocked in whatever I want to do. And then China feels she is weak, and so people attack.
One person answered in the chat box.
Yes.
One person answered in the chat box. Please check. China is mentioned.
Yes.
Yeah. Tacitin Illeri, I think from another country mentioned China.
Okay. From China. Okay.
No. China, Tacitin Illeri. I don't know from which country. Can you, Tacitin Illeri, can you just state your, where is Tacitin Illeri? Can you? Tacitin Illeri is from other country, I think. Tacitin Illeri, you can unmute and express yourself. Tacitin.
We want to see her. We want to see her. I don't know whether she or he. He. Okay, he.
Tacitin Illeri. That is what is written as the name.
I am from Turkey.
Turkey.
Oh.
Thank you. You are the winner.
I'm
Mustafa.
an engineer, but fond of homeopathy for 20 years.
Oh, very good. The land of Mustafa Kemal Pasha. Kemal Pasha.
True.
Yeah. Okay.
Thank you for good presentation. We can continue. Thank you very much.
Okay. Thank you, Mr. Sir from Turkey. Thank you very much. And the remedy was China. China was the first remedy proved by Samuel Hahnemann. It produces intermittent fever, and it has got sudden attack of fever with chills, sudden attack without any premonitory symptoms, without any what they call preliminary symptoms. The fever appears suddenly from the skies, suddenly from out of the blue. The fever appears and with chills. And the mental state of China is, I am weak, and so people attack and trouble me. So wherever she goes, people attack her. So in her house front, she is attacked, and her office front also, people are conspiring against her and attacking her. Okay. And feeling of being persecuted and hindered. She is being harassed and hindered. Hindered means blocked. She is obstructed from achieving her life's ambitions. A person, the mental state of China has the feeling of being obstructed from achieving life's ambitions. She herself has said, I was not able to achieve my life's promise. That is what she said. And so what does she do? Because she is not able to achieve her life's promise, what does she do? She sits somewhere and builds castles in there, builds daydreams. She daydreams. She just goes on building castles in there. Then feeling of being tortured and tormented even when she described her symptoms, this woman will use the word torture and tormented, because she was telling me, I am so much harassed and agonized and tormented by this stupid infection, which has been tormenting me for the past 19 years. Okay, even in the way you describe your symptoms, a China person may use the word torment or a similar word. Okay, and a person builds castles in the air. Okay, and this is a periodic remedy, isn't it? This is a periodic remedy. It doesn't continue completely all along like that, but it appears in brief intervals. It appears now and stays for some time, remains for some time, and then it will again come back after a period. And you see, China was the remedy I gave this woman. I gave this woman China officinalis 30th potency, only 30th potency one dose. And usually in many of my cases, I start with the 30th potency, because I started using the 30th potency after I heard Amar Nikam, because we consider the 30th potency as a very low potency. In fact, it is not like that. It has got 60 zeros. After an initial digit, there are 60 zeros. Actually, Hanuman never used a potency. Please, noise. Hanuman never used a potency. Somebody is interfering. Hanuman never used a potency over the 30th potency. And very often when we fail in our prescriptions, many people blame our potencies for the problem. No, sir. Potency is not the problem. You gave the wrong remedy. That is the main problem. When treating a person, achieving the right result mainly depends on giving the exactly right remedy. Whether it is given in the 30 or 200 or 1000, it will definitely do something. And I gave this person China officinalis in the 30th potency, and her fever disappeared within 36 hours. And not only that, for the past 2 years, she developed only one spell of fever, one spell. After about 6 months, she developed a spell of fever, one spell of fever. And then I again gave her another dose of China officinalis therapy. And that immediately drastically removed her symptoms within 24 or 36 hours. And she has been remaining almost symptom free for the past 2 years, and she has been feeling fairly well. And also some improvements have been achieved in her home front also. Nowadays, she's having a better relations with her husband, and she is feeling less inclined to attack her husband and harass her husband for each and every trivial thing. She's overall, her sense of well-being has become better, and she thanked me profusely for removing that tormenting disease which had agonized her for 19 years. Just think of it, 19 years. This was as a malady which caused unmentionable terror and torture to that person. Just with the potency, China official has 30th potency, she has improved very greatly. And if she ever gets any other bout of fever, now I'm seeing her only very rarely, once in a while, for some trivial thing or something else, she comes and sees me. I mostly give her placebo. If she ever develops another spell of fever or anything like that, I intend to give again this China 30 potency. Okay, so my dear friends, homeopathic medicine is a miracle. There is no doubt about it. The right medicine, the right dynamic medicine, when it proves simillimum for the patient, can work miracles. That is what I believe, my dear friends. So that is one case. Actually, I have got one more case with me, but I think the it won't be sufficient within the time limit.
Yes.
And another problem also, see, I am a fairly senior person. I am 70-year-old. So I don't think
we can schedule you for another day, sir. We can schedule you for another day.
Okay. I don't think I have the right mental makeup because I'm feeling tired. Okay. If the audience want to say any comments or any other suggestions or comments on this person or remedy or about homeopathy in any other aspect, you are always welcome, dear sirs. I am very eager to hear and listen from you. Okay.